How can you recognize the types of depression? Depression is a mental health condition that affects millions of people worldwide. And it's not just feeling down for a few days. It's a complex mental health condition that impacts emotions, thoughts, and daily activities. It's a persistent sense of sadness, hopelessness, and a loss of interest in things you once enjoyed. Depression can show itself in many ways. Often referred to as an invisible illness, it can affect people of all ages without obvious outward signs. However, depression can have somatic symptoms, manifesting as physical discomforts such as chronic fatigue, unexplained aches, and gastrointestinal issues. The good news is that depression is treatable. In my videos and across various platforms, you will find plenty of tips and support to help cope with this problem and improve mental health. Please subscribe and like the video to help my content reach more people, so I can assist those who are seeking healing. Now let's take a deeper dive into the different types of depression. Each type has its own set of symptoms, and recognizing them can be the first step toward understanding and managing depression effectively. 1. Major Depressive Disorder. This is the most common form of depression, often referred to as clinical depression. Major depression often creating a sense of emotional numbness or a void that makes even simple tasks feel overwhelming. This disorder is characterized by hopelessness and a lack of interest in activities once enjoyed. It can distort thoughts, leading to feelings of worthlessness and excessive guilt, even without clear reasons. The symptoms must persist for at least 2 weeks and cause significant distress or impairment daily functioning. According to the World Health Organization, major depression is a leading cause of disability, affecting over 264 million people worldwide. 2. Persistent Depressive Disorder. It's also called dysthymia. Persistent depression is a long-term form of depression that lasts for 2 years or more. Unlike major depression disorder, the symptoms of dysthymia are less intense but can be longer-lasting, causing significant impairment in daily functioning. This form of depression is chronic and recurring, meaning that individuals may experience periods of relief, but the symptoms return over time. Globally, persistent depressive disorder affects an estimated 3 to 6% of the population, with varying rates across different countries. 3. Bipolar disorder. There are 2 main types. Bipolar. 1. Where manic episodes are more severe and often require hospitalization, and bipolar 2, where hypomanic episodes are less intense but still disruptive. In the depressive phase, the person will experience symptoms of depression, but during the manic phase, they may feel unusually energetic or overly confident, sometimes engaging in risky behavior. Globally, approximately 2 to 3% of the population will experience bipolar disorder at some point in their lives. The disorder typically begins in adolescence or early adulthood, with the average age of onset being around 25 years old. 4. Seasonal Affective Disorder. This type of depression occurs at specific times of the year, usually during the winter months when there's less sunlight. It is linked to changes in light exposure, affecting the production of serotonin and melatonin in the brain. Symptoms of seasonal disorder include low energy, irritability, difficulty concentrating, and changes in sleep and appetite. Seasonal affective disorder affects an estimated 1 to 10% of the population in temperate climates. It is particularly common in northern countries, with some studies suggesting that up to 9% of people in Northern Europe experience seasonal depression. 5. Postpartum depression. Postpartum depression occurs after childbirth, and it goes beyond the baby blues. Women with postpartum depression may experience severe emotional and physical symptoms such as feelings of worthlessness, exhaustion, and a lack of connection with their baby. 6. Atypical depression. Atypical depression is a subtype of major depressive disorder that is characterized by specific symptoms, such as mood reactivity, the ability to experience temporary relief from sadness in response to positive events. However, other depressive symptoms like overeating, excessive sleeping, and heavy limbs persist. 7. Situational depression. This is a temporary form of depression triggered by a specific life event, such as a job loss, a breakup, or the death of a loved one. Understanding the different types of depression can help you or someone you care about identify what they're experiencing. Whether it's a short-term setback or a long-term challenge, recognizing the signs is the first step towards getting the right help. If you're dealing with depression, don't hesitate to reach out to a mental health professional. Thanks for watching, and remember, you're not alone. Everyone needs to rest in a safe nest to rise again.